Hello, I'm announcer Jung Yeonju, and I'll be your new host starting today. It's nice to meet you. Thank you. Yes, I'll be providing helpful medical information in a friendly way for your healthy and happy daily lives. Yes, today is the first day of May. Since it's a public holiday, I think many people will be going on spring outings for the long weekend. To make the most of this precious golden holiday, we can't leave out our joint health. Today's topic is a condition that is said to be common, especially among growing teenagers. We're going to talk about Osgood-Schlatter disease. We're here today with Director Yoon Sang-soo from Seoul Bumin Hospital to discuss this. Hello, doctor.
Hello.
Yes, Osgood-Schlatter disease. The name itself is quite unique and unfamiliar. What kind of condition is it exactly?
Yes, we've prepared some slides. I'll be presenting today on the topic of Osgood-Schlatter arthroscopic surgery. Osgood-Schlatter disease is a condition where the area below the kneecap, which is usually slightly protruded in most people, is exceptionally prominent. Why can this be considered a disease? As for how it got its name, American Dr. Osgood and Swiss Dr. Schlatter coincidentally first described this disease in the same year, 1903. It was named after both of them. To be precise, it's Osgood-Schlatter disease, but we often just call it Osgood's disease for short. Since it's named after a person, we call it Osgood's disease. But as for why a protruding knee is a disease, you can see here that a piece of bone has broken off. As the knee protrudes, you can see a bone fragment on the tibia in the X-ray. Announcer Jung Yeonju, have you ever heard of Osgood's disease before?
No. It's a condition I'm encountering for the first time, so I actually looked it up before the broadcast. From what I know, it's a condition where the upper front part of the shin bone protrudes slightly, and it's common among growing teenagers. Did I study that correctly?
That's right, exactly. So if you look at this MRI, this part where the patella or kneecap attaches is the patellar ligament. When we do squats, climb stairs, or straighten our knees, these thigh muscles and the patellar ligament pull on the tibia bone below, allowing us to straighten our knees and use force. But when children are in their growth phase, meaning their growth plates haven't closed yet, there's a growth plate here too. If children play soccer, basketball, or do a lot of jumping and rope skipping, the ligament keeps pulling on the growth plate, causing a bone fragment to break off and become inflamed. That's Osgood's disease. As for the cause, as you mentioned, it's a disease that mainly occurs in children who do a lot of jumping exercises, though it doesn't happen to everyone. How is it treated? Resting is one way to treat it. And since there is inflammation, you can use anti-inflammatory medications and also apply patches. I see many patients with Osgood-Schlatter disease, but many of them come to me after already getting injections or shockwave therapy at other hospitals. Because the ligament area hurts from inflammation, it is not diagnosed as Osgood-Schlatter, so they get these treatments, but I am not so sure. I mean, injections might damage the ligament more, and shockwave therapy seems like it would hurt by causing more friction between bones. But anyway, many people come after having these. But then we also explain the next treatment, which is surgery. This Osgood-Schlatter surgery is a method I found online. Now, textbooks say that Osgood-Schlatter is not a disease that requires surgery. The reason can be seen in this photo. After making an incision in the knee, this white part is the patellar tendon. So the Osgood-Schlatter bone fragment is located on the inside. To remove it, you have to split the tendon like this. Making an incision, splitting it, and removing the bone fragment from the inside is the surgical method. But since you are splitting a healthy tendon, it must be painful for patients. Then there are difficulties in rehabilitation, and because the surgical results are not great, it is a disease that is not operated on. It also leaves a large scar like this. Now, it was simply known as that kind of disease, but I ended up publishing a paper on a surgical method developed and taught by my mentor, Professor An-Jin Hwan. So it is a paper titled Arthroscopic Ossicle Resection for Osgood-Schlatter disease. This is a method of removing it while looking through a camera behind the patellar tendon. When we say arthroscopy, it means the surgery was done by making two holes like this. Since we perform the procedure by working through small holes located right next to the patellar tendon, we are able to carefully grind away and remove the bone without making a large incision. This means you can walk and even be discharged on the very same day. The scar looks like this, but about 6 months after the surgery, the scar fades so much that it is almost invisible, so it is an excellent surgical method aesthetically as well. But then Osgood-Schlatter is originally a disease that is not operated on, but people who need surgery, they come to see me. Who are they? Ultimately, they are people with unresolved pain, mostly soldiers in their 20s. When they go to the military, the amount of training increases significantly. And because the amount of exercise is more than what they used to do, those who originally had Osgood-Schlatter come in with a lot of pain. And there are many people like this too. They suffer from knee inflammation once or twice a year. And these days, many people exercise a lot. They enjoy daily exercise, but it hurts while doing it and aches at night, making it hard to live and preventing them from doing what they love. Also, it hurts a lot when they bump the protruding part of their knee. You just bump it while walking by. Then you go, ouch, and it's just so unpleasant. And since many professional athletes also have this condition, they come to see me. Also, while providing this treatment, I've noticed quite a few gout patients come in as well. It often occurs together, and I'll show you some cases of that later on.
Yes, doctor, listening to your explanation just now, a question came to mind. You mentioned that Osgood-Schlatter disease involves a slight protrusion at the top of the shin. Is pain always a necessary accompaniment to that? Or is it possible to have the protrusion visible without any actual pain?
Most people don't actually feel any pain. 8 or 9 out of 10 don't have pain. Only 1 or 2 people might actually feel pain, and even for those individuals, they usually do not require surgery. Most cases tend to improve with rest, physical therapy, or by using things like hot packs or warm compresses. However, among those people, the ones with persistent pain that does not resolve or go away eventually come to me for surgery. So basically, it's correct to say that Osgood-Schlatter disease is not typically a surgical condition.
Oh, I see. Then let me ask another question from the comments that just came in. User Science Korea 123 says, I'm a man in my mid-50s. I have stage 3 degenerative arthritis. My cartilage is also in bad shape. If I have both Osgood-Schlatter and stage 3 arthritis, should I have the Osgood-Schlatter removed during joint replacement surgery? Or is it better to just do the joint replacement?
Well, that's a bit of a tough one. The patellar ligament is actually very important during joint replacement surgery, so we perform it, but we move the ligament aside like this. By moving the kneecap aside, the Osgood-Schlatter bone fragment becomes directly visible. So during surgery, it's generally a good idea to remove it at the same time.
Right? As he mentioned, it does protrude quite a lot, so I really hope that my answer was helpful to him. I hope it gave him the information he was looking for.
So I've actually gone ahead and prepared a little quiz for us to do together today. Announcer Jung Hyun Ju, do you happen to know what our country's national income is?
National income? Oh, well, that's a bit of a difficult question. What is it?
It's around $35,000 or $36,000. That's right. This actually brings back a memory from when I was a resident. My seniors used to share advice and little pieces of wisdom with me, and I always made sure to write down the ones that really stood out. One of those sayings stuck with me, so I decided to turn it into a quiz for you. I want to see if you can fill in the blanks, just like I tried to do when I first heard it. Well, in a country with a national income of $20,000, referring to the orthopedic department, in orthopedics, there's the shoulder, elbow, wrist, fingers, hip, spine, knee, ankle, toes, and the foot. It's all orthopedic surgery. Any part with bone is orthopedics, but it's divided into subspecialties. So when the national income is $20,000, there are many patients in blank and blank parts. What could it be?
What is it? Viewers, please help me out here. At $20,000 national income, there are many patients in blank and blank parts. For me, I'll go with wrist and ankle.
Wrist and ankle? Oh, you're completely wrong.
Was I wrong?
There are many patients for knees and spines. Since you're young, you probably don't have any pain, but the part that hurts the most as we age is the knee joint. And then the spine has the most patients. Even now, you can see it's the part with the most patients in orthopedics. Now, there's one more question. Then the country develops to a national income of $30,000. Our country has developed, right? So we're talking about this based on which orthopedic specialties became prominent in the US. Since the US reached $30,000 and $40,000 much earlier than us, at $30,000, patients in a certain part start to emerge.
Oh, I really want to get it right this time. At $30,000 national income, patients in the blank part emerge. Oh, what is it? I'll try shoulder this time. Am I wrong again?
It's the foot. Shoulder is also correct, actually. After knees and spine, many patients for shoulders and feet start to appear. We can explain it with this. Knee arthritis, like the artificial joint question earlier, the knee is a large joint and it aches when walking. Since people seek treatment when it hurts to walk, there are many knee patients. Have you heard of hallux valgus on the right?
Yes, I've heard of it.
It happens to young women too, where the foot bends like this and this part protrudes. Wearing high-heeled shoes compresses and squeezes the feet, often causing this painful condition. People sometimes get surgery to relieve the pain, but it is also done for cosmetic or aesthetic reasons. So what does this mean? When it's hard to make a living, we tend to focus on the absolute essentials. But as we gradually gain more economic leeway, people start paying more attention to the finer details in life. The reason I explain this is that I believe Osgood-Schlatter disease has a similar aspect in the way it becomes more noticeable as circumstances change. In the past, if you had Osgood-Schlatter disease, people generally believed it was not something that required surgery. Instead, the usual advice was simply to rest if it hurt, and most people just accepted the pain as a normal part of life. Back then, there was little focus on actively treating the discomfort, and it was often seen as something you just had to live with. However, now the world has changed. These days, patients' discomfort, as well as their desire for effective treatment for issues that interfere with their ability to participate in sports or enjoy leisure activities, are now being highlighted and taken much more seriously. Because of this shift in perspective, I believe that we can now also address and fix Osgood-Schlatter disease surgically.
You gave us a quiz about which medical fields are developing based on national income, and I was wondering what the point was, but I see it was about this. So regarding Osgood-Schlatter disease, could you tell us how the arthroscopic surgery is performed?
Yes, arthroscopy is better than making a large incision. It's good because it minimizes damage by just making small holes, but when is it done? It's for severe knee pain that doesn't improve with medication. The results are good because the ligament isn't cut. The key point is that it permanently solves the problem by removing the bone fragments. It minimizes damage to normal tissue by going behind the ligament. This allows for faster rehabilitation and return to activity, and it's cosmetically superior due to minimal scarring. If you look here, I've marked it to make it easier to see. You can see the yellow bone fragment, but there are also sharp bone growths underneath it. Since these irritate the ligament, we don't just remove the round yellow fragment, we also shave down these sharp bones, which is almost like a cosmetic procedure. Just like that, we grind down the painful protruding bone to make it more comfortable and pain-free for the patient. So while bone fragments are usually detached, there are cases where the bone just grows out like this. In the past, we didn't perform surgery on these patients. I only operated when there were detached fragments, but patients were experiencing a lot of discomfort. So thinking that these growths might also be causing irritation, I started shaving them down, and the patient outcomes have been quite good. Also, it's common for both knees to be affected. This is a photo showing both the right and left sides successfully cleared during a single hospital stay. And this is what the bone fragments look like after being removed and photographed externally. Let me show you a video of the arthroscopic procedure. After grinding the bone, you can see the Osgood fragment embedded within the ligament. After thinning it out a bit, we use a tool called a curette to scrape and detach the bone fragment. We break it into smaller pieces using a technique called the piecemeal method, and then we carefully extract each of those pieces. By entering from the side and from behind the ligament, we can carefully remove the fragments without damaging the ligament itself. We also gently shave down those sharp protrusions, much like what is done in a reconstructive procedure.
Oh, that's really fascinating.
If you look at the paper I mentioned, you can see the white ligament is well preserved. So it's a method that avoids injuring the ligament. After I published and presented my paper, I've become essentially the only one performing this specific surgery in Korea. So with many patients gathered, we have about 180 slides today. I'll show you some patient photos focusing on cases. This is a 31-year-old male patient, and the Osgood bone fragment was removed like this. If you look at this video, you can see the bone fragment as soon as you enter, and there's more bone underneath like a large iceberg. So to see that, we're gently grinding the bone with a burr to make it thinner.
I see.
This is the ongoing process of carefully making it thinner, step by step, over time.
Oh, okay.
So it has now come loose. After making it thin, if you gently grab it and slowly pull it out, you will see that it is about the same size as the bone fragment on the right, about 1 centimeter. And if we gently smooth out those protruding parts we saw earlier, you can clearly see that the ligament itself is actually perfectly fine, showing no damage at all.
Wow, that's amazing. Seeing the surgery firsthand like this, it's quite reassuring, and I think those who were worried can feel a bit more at ease about getting treatment. Oh.
So I'll continue showing you more cases. So for the detached fragments, the bone pieces are like this, and you can see they've been removed here as well. If you look at the symptoms, you can understand why these patients were suffering.
Oh, I see.
A 23-year-old male, difficulty running and doing squats. Next is a 37-year-old male patient. The bone fragment is gone. It seems he had significant discomfort, having to wear a cast as a child due to constant pain.
Yes.
The 29-year-old male patient also had surgery for knee swelling. And then there's CrossFit, which many people seem to do these days.
That's true.
As I listen to these patients' personal histories, I can truly see what is bothering them, and I notice how our lifestyles are gradually changing.
Yes.
So it hurts when sitting down. This person really felt the need for surgery because of pain during leisure activities like basketball or walking while traveling, and discomfort while driving. We removed this bone fragment. It looks like this on arthroscopy, and the ligament is fine on the MRI as well.
Oh, okay.
This person who said it hurt during squats or when bumped also had surgery like this.
I see.
Well, there's no rule that says there can only be one bone fragment.
Right?
This patient actually had several of these injuries. As you can see, it looks a bit messy and somewhat confusing on the X-ray, but if you take a closer look, the CT scan clearly shows there are about 4 distinct fragments, all of which were carefully and successfully removed during the procedure.
Yes.
The person who had pain while running also had several fragments removed. Next, there was a patient with a very large bone fragment, a really big piece of bone, and it's about this size. It's almost as big as this bone here. And when I first saw it, I wondered, can we even operate on this? If we remove it, will the ligament... I was quite worried that it might not survive, but we worked hard to grind it down during surgery, and by removing it all, the patient was very satisfied. The ligament was fine too. There are also many people who undergo surgery on both knees. As you can see, there were bone fragments in both knees that caused a tearing sensation when playing basketball, table tennis, or standing up, but they're gone now. A 27-year-old male also had large bone fragments in both knees, and they were successfully removed through surgery. A 24-year-old male who plays soccer, this bone is also very large. When we operate at once, it takes a little over 30 minutes per side. So even if we do both sides, the surgery takes about an hour, and patients are discharged the next day walking, and they can go about their daily lives. Now, the reason we can do this is that if you look at the MRI after surgery, although the ligament looks a bit thinner here, there's enough healthy ligament on both sides. We only removed the part where the bone had grown in, so it just looks like an empty space, and I explained that the ligament is fine on the MRI. Now, to take a more scientific approach, we performed measurements to see if the knee strength was okay. So let me show you some cases measured using a device called Val-D. So they say their knees hurt so much after exercising on stairs. The bone here is protruding like a horn, and there's another bone embedded below, but it was removed well. But the strength in the left knee was a bit weak. The left knee strength went from 230 newtons before surgery to 338, so about a 50% increase in leg extension strength, which we measured 3 months after the surgery. Gout, Announcer Jung Hyun Ju, do you know what kind of disease gout is?
Oh, gout. I think I've heard of it before, as an illness that adults, especially older people, tend to get. Isn't that right? Gout, I'm not exactly sure.
That's correct.
Is it?
You're right. Gout is a disease where uric acid levels increase. So if the normal uric acid level in the body is 7, this patient's level is a bit higher than 7. Then it's related to drinking beer or certain dietary habits. After eating foods high in uric acid, the toes usually get red, swollen, and painful. So it's a disease where people are rushed to the emergency room in extreme pain. But this is it's mostly known to affect the toes, but while treating Osgood-Schlatter patients, I've found that inflammation can also gather around the knee tubercle, and quite often these patients also present with gout. So I'm going to show you some of those cases. Similarly, this patient had surgery on his left knee, and the extension strength in that knee was very weak, only about 1/3 of the strength in his right knee.
I see.
He had pain while doing squats and had been a competitive soccer player and speed skater since he was young.
Yes.
He came in with symptoms like being unable to lift his leg after getting an injection, but if it's gout, it looks different on an MRI. On an MRI, these white areas indicate inflammation.
Right?
So there's a lot of inflammation, and when we look inside with an arthroscope, these white, chalky-looking things are gouty toffee. They're uric acid crystals. These things just spread out like scattered snow. So in cases like this, we perform surgery to remove the crystals. The post-op MRI might look a bit like this, but the surgery was successful. This is a 29-year-old male, and again, the extension strength in his left knee is weak. He's a soccer coach and experiences pain about twice a year.
Yes.
So it's like a recurring event for him. He came to us because he heard that this annual pain could finally be fixed. Looking inside, you can see those gouty toffee I mentioned floating around. They were all cleanly removed during surgery.
I see. Right. From what I recall, I thought gout was quite difficult to cure completely. Does having surgery like this help alleviate the gout to some extent?
Not exactly. As you mentioned, gout requires dietary management, and if that's not enough, there are medications to lower uric acid levels. If you take that medication and keep your levels below 7, the frequency of these painful episodes will decrease. So you really have to manage your diet well. You shouldn't drink things like beer.
So you have to follow a strict diet?
But we can use arthroscopy to address the parts that are very painful due to inflammation. This person is also a gout patient who has pain several times a year while jogging. When it hurts, he can't bend his knee. These are symptoms of severe inflammation, and he was in too much pain to apply any pressure. So looking at the MRI, I said the white parts are inflammation, right?
Inflammation, yes.
Inflammation severe.
Oh, I see.
There's inflammation in the bone as well, and inside you can clearly see those chalky uric acid crystals that are embedded there. We removed all of them during the surgery.
Right?
This is a 32-year-old male who's a bodybuilder preparing for a competition. He'd already received many treatments like shockwave therapy and injections before being diagnosed with gout. There was inflammation even before we went in. Inside you can see the crystals. His uric acid level was 7, which is what it dropped to after taking medication. For some, it can go up to 8 or even 10. In that case, you'll have to take medication to lower your uric acid levels.
I see.
This is a 34-year-old male, gout, inflammation, and he's a pastor by profession.
He's a pastor.
He's a pastor.
Yes.
Liver, cholesterol, and uric acid levels are all high.
Oh, how did this happen?
He needs to manage his diet better.
Right?
Anyway, since there were nodules, we performed surgery on the severely inflamed areas, and it looked like snow powder was fluttering around.
See?
And this is how it looks after being successfully removed.
Yes.
This 41-year-old male patient who plays soccer had uric acid nodules forming on the outside of the ligament, just like this. The inside was also quite messy and disorganized. When we went in, we found uric acid nodules embedded everywhere throughout the area, so we removed them altogether.
I see.
So after the surgery, even though it looks like we removed everything up to the outside of the ligament is fine and everything was removed.
Yes.
64 years old, he's quite old.
He's quite elderly.
As you get older, you tend to suffer more and more, and as a result, the bone actually grows even more over time.
Right?
So there's this horn-shaped bone, and then this empty space here is a bone cyst.
Yes.
An empty space like a bone cave is formed.
I see.
So with this condition, he complained of not being able to go downstairs, and on the CT scan, you can see there's a lot of stuff there.
Indeed.
And there are many horn-like bone fragments, and the bone inside is empty. Yes, we can remove all of that through surgery for this patient as well.
Right?
This person's uric acid level was originally 10, and although it was reduced to 4 with medication, the inflammation still flares up occasionally, and the white part is a bone cyst. This is something we occasionally see during surgery, and I think this bone fragment is digging into the bone as it receives impact.
Oh.
The repeated hitting creates an empty space inside, which is a bone cyst, and we removed that successfully as well. So I'd like to show you a video of this. This is where we thin the bone and then scrape it out. Scrape, scrape. It's like scraping watermelon out of the rind when making watermelon punch, peeling it away from the ligament.
Oh!
By peeling it away piece by piece like this, we can separate the bone from the ligament while minimizing damage to the ligament.
I see.
So this is the process of lifting it up. With a pop, the bone fragment has been lifted up. Now we have to grab it and pull it out.
Right.
So this is the surgical video of this patient where the bone fragment was removed and the ligament is perfectly fine. Those were the symptoms. So for those who say it really hurts after a bump, and on an MRI, the bone shows up white. It could be a bone bruise or, in severe cases, an Osgood fracture where the bone actually breaks. If you look at this case, it's a 56-year-old woman, and this bone fragment here is one piece. But that white line in the middle is actually a crack. Bumping it can cause a fracture like this, and it's extremely painful.
Yes, I can imagine.
So we removed it successfully. Actually, a famous pro women's basketball player had surgery with me for an Osgood bone fragment fracture after hitting her knee during a game about 5 years ago. This patient is a 34-year-old man who fractured a bone at the gym, and it was successfully removed. He played a lot of basketball and had swelling 3 times a year due to inflammation. We saw signs of a bone fracture, so we removed it. It was removed well, but some remains in the ligament. His right knee hurt so much 4 months ago he couldn't walk. His leg just gave out. Looking at the CT scan, this round shape inside is a bone cyst. Like I said, the bone hitting creates an empty space. And when you go in, there's something filling it. We can scrape that out and perform the surgery.
Oh, doctor, I have another question here. You've shown us a wide variety of surgical cases. But if we take a look at the comments, Egg Cookie asked, does the pain definitely go away after surgery, or is there a chance of recurrence? I'm curious about the realistic outcome.
Patients seem very satisfied with the pain relief. But as for recurrence, I've been doing this surgery for about 10 years now, and there hadn't been any, but I spent about 2 months preparing for this presentation, gathering all the cases I've operated on over the years. Then suddenly this week, a patient I operated on 4 years ago came in with a recurrence. So I added a slide for it. Let me show you.
Shall we continue watching?
Looking at the bone cyst I was explaining, what happens is that the bone fragment strikes and creates an empty hollow space. The patient described this as an indescribable kind of pain which occurs whenever it gets bumped, usually about once a month. This pain is very hard to put into words. This is exactly what we saw inside the bone cyst. Yes. It's quite large when squatting, and this area here is where the bone is hollow. This is also a view inside the empty space. That white part is the hollow area. I'll show you the bone cyst surgery along with the Osgood procedure. So as much as possible, this person, whether it's a gouty tophus or from many steroid injections, there's this white powder that doesn't usually fly around like this. So it's a situation where we're clearing it out together. Still, we're removing these bone fragments well, separating them from the ligament, and we're starting by removing the Osgood bone fragments first. It's a bit of a messy situation, and we're taking extra care as we work on separating them. We're proceeding slowly and methodically, making sure to be as gentle as possible so that we do not damage the ligament while removing them. This process requires patience and close attention to detail, and we're making sure to check each step to ensure everything goes smoothly. So, after the bone fragments were removed to some extent, the view became clearer. And as we were proceeding, we moved towards the bone cyst. Right now, this shows the bone fragment being exposed, like I showed earlier, and we're grinding it thinner to break it into pieces. But if you look deep down there, you can see something like a cave or a hole. And it's filled with something.
Yes, it is.
This is a bone cyst. There's usually something present inside a bone cyst. So when I put in a tool to gently scrape it out, something similar to mucus usually comes out. Since these things cause inflammation and pain, in orthopedics, we perform a procedure called curettage to scrape out the material inside a bone cyst. After scraping it out like this, you can see the clean bone inside the cavity. Once we've cleared that space, normal bone can sometimes gradually fill it back in. So, after performing this curettage, the white area inside the bone cyst is actually where we just scraped it out. Ultimately, the cause of these conditions is that the more children run and exercise when they're young, the higher the chance of them developing, so they often occur in former athletes. A 20-year-old patient who was a taekwondo athlete as a child and now works in beauty and has to wear a brace while working, came in and we successfully removed the bone fragment here. This is a 34-year-old male who had many steroid injections and was a swimmer until middle school. It seems it can happen even with swimming, even if it's not just running. Next is a former volleyball player who's now in the military. We performed surgery to remove bone fragments like this. And this person was a track athlete as a child and is also a soldier now. They had surgery for bone fragments like these.
These symptoms definitely seem to appear more often in people who used to exercise.
That's right. So I'll continue showing you cases of athletes. Here's a soldier who used to play soccer. Removed. And this person played baseball in elementary and middle school and was diagnosed in the 8th grade during their growth period. Usually they already know. Because the front of the knee sticks out like this, they wonder, what's wrong? So they get an X-ray at the hospital and find out it's Osgood-Schlatter disease. This isn't a condition that requires surgery. If it hurts, you take medicine, do physical therapy, and rest. So most people grow up knowing about it and finishing their growth, but then they face the tough situation of military service and feel they need to resolve it. So for this soldier whose bone fragments were quite large in both knees when walking or bumping them, we removed them well like this.
As you mentioned, it seems you've shown many cases where people knew about the condition in their teens during growth but had surgery as adults. Do many people actually undergo surgery during their teens while they're still growing?
It's not common. As I mentioned earlier, since this is not a condition that absolutely or strictly requires immediate surgery, what we usually do is advise children to take it easy and rest more than usual, to try some gentle thigh strengthening exercises at home, and to come back and see us again if they are still feeling uncomfortable or experiencing any pain later on. If, after all of that, things still have not improved, that is when we might consider operating. Now, there is a question.
Yes, let me read a comment. From Kim Gengi, I'm a woman in my 70s. When I kneel or get up from the floor, I feel a stabbing pain in my shin. I'm wondering if this could be something other than simple arthritis. That's what she asked.
The shin. Shin pain varies depending on where exactly on the knee it is. If it's the front, it's the patellar tendon. If it's the inside, it's the meniscus. Even the back could be arthritis or the meniscus. Since she's in her 70s, which is considered an older age, it is most likely degenerative arthritis of the knee. In addition to that, there is also the possibility that it could be tendonitis. So accordingly, but getting up from the floor is very difficult. It's also not good for the knees. So when it comes to taking care of your knees, it is generally better to use chairs and sofas for sitting instead of getting straight up from the floor. Avoiding positions such as kneeling or sitting cross-legged is also considered to be better for maintaining your knee health. Taking these small steps can help protect your knees over time.
Thank you for the lifestyle tips.
Let's continue with the presentation. So while the previous cases were about those who were athletes in their youth, the cases I'll show now are active athletes. This is a pro soccer player currently in the military with symptoms like pain when using stairs or kneeling. He had symptoms of temporary immobility due to pain. And as you can see, the bone fragments are quite large. There were fragments and they were successfully removed. Looking at the knee strength, it was 198 before surgery, 253 at 1 month, and 311 at 2 months. Since the extension strength keeps returning, this surgery is actually very helpful for athletes.
Yes, that makes sense.
Next is a 19-year-old taekwondo athlete. He's young, but he had surgery because he couldn't squat like this, and we successfully removed the fragments from both knees. There are many taekwondo athletes.
I see.
This is a 20-year-old male taekwondo athlete. In this case, the bone fragment didn't break off, but the bone grew out and split. Looking through the arthroscope, you can see the cartilage where it's divided in two. It's this part, and it's also here. Before surgery, I explained to many patients that they shouldn't view this as a cosmetic procedure. If we approached it cosmetically, we'd have to remove everything up to here so the bone wouldn't look like it's protruding. But we can't do that because the patellar tendon must remain attached. Using knee strength to run, straighten the leg, or climb stairs requires the thigh muscle, the kneecap, and the patellar tendon to be attached to the lower bone so they can move as one unit. If this connection is severed or removed, you won't be able to use your leg. That's why this is absolutely not a cosmetic surgery. It's crucial to preserve the exact area where the ligament needs to remain attached. We didn't used to operate on cases where the bone fragment hadn't detached, but nowadays, if it's very painful, we perform surgery to remove it. Looking further at Osgood-Schlatter disease without detached fragments, you can see the bone protruding like this. It looks like this on the X-ray, and from the outside, it's quite prominent, which causes discomfort for the patient. This patient has dealt with this since high school. He works in a factory, which involves a lot of knee bending, and it hurts even when he's still. Ultimately, the bone rubs against the back of the ligament. When using the knee to bend or climb stairs, that internal friction causes the pain. So if we remove this irritating bone fragment, the patient's symptoms will improve. This patient had extracorporeal shockwave therapy. We removed it, and the ligament looks good. This former basketball player had pain in his left knee when sitting cross-legged. There was no fragment, but we operated as we went down. This person was worried about enlisting in the military, wondering what to do about this Osgood-Schlatter discomfort that occasionally prevents bending. This wasn't a detached bone, but this is how it looks after being shaved down. Someone asked earlier if we operate at a young age. We generally avoid it for young athletes, but I'll show you about 3 cases where we did. This is a 23-year-old male who's been in pain since childhood. The fragment was quite large, we removed it, and the ligament is fine. 18 years old, he's young. He is young. Despite being young, there's a fragment and clear disease. He had trouble running and squatting, so we operated. This is the youngest case, a 17-year-old male. Right. Announcer Yong Yeon-ju, do you happen to know at what age the growth plates close?
Oh, well, it varies a bit from person to person.
True.
I know it's a bit different for men and women, but isn't it usually around 15 or 16?
That's exactly right.
Is it?
So it's true that it's a bit earlier for women, 15, 16, 17. And for men, growth plates close up to age 18, which we can see on an X-ray. If this white part here is separated, the growth plate is still open, but for this patient, it's closed. So there are growth plates here, here, and here in the knee. And since they were all closed and the patient's Osgood symptoms were clear and uncomfortable, we performed surgery even at age 17.
Okay, let's take a question from a viewer. From Science Korea 123. They want to know if there's any risk or difficulty in rehab when doing Osgood and knee replacement surgery together, or if there's almost no difference in pain in rehab compared to just having the replacement.
If the Osgood bone fragment is clearly poking the patellar ligament, I think rehab would actually be much easier. With a knee replacement, you have to work hard on rehab to bend and straighten the knee, rather than having a bone fragment poke the ligament every time. If you just do them together, the risk isn't that high. And the results after surgery would likely be better.
Okay, let's move on to the next question. From Fate is an Excuse. Hello? Thanks for another great broadcast. Thank you for watching. Also, if it's a long-standing case of Osgood-Schlatter disease, it's probably already hardened, but can arthroscopic surgery still reduce pain at this age? They asked, but I wonder what age range they're in.
Well, I have that later. I'll show you a group of older people later, but basically, you do it if it hurts.
If it hurts, so you're saying the criteria for surgery is pain. From I see, that's how it is. The area below my knee is protruding and the pain is severe, and the hospital said it's Osgood-Schlatter disease. They say it gets better if I rest from exercise, but it keeps recurring, so I'm curious about the criteria for how long I should endure it. And they say they're currently a middle school student?
I always send middle schoolers back. It's better to really rest, take anti-inflammatories, reduce exercise a bit, or change the way you exercise. As I said before, we make a judgment at least after the growth plates have closed.
I see. Another question has come in. This seems like an orthopedic question. From Goodluck J153. I heard the lower back should be in a C shape. In that case, would putting something like a cushion under my lower back when I sleep help create that C shape? I'm curious about this too.
It does help. But honestly, I really think that this is just a completely meaningless prescription and piece of advice because honestly, who doesn't move at all while they are sleeping, right? So while it might help when you first fall asleep, if you observe, you won't be able to maintain that posture or keep the pillow in place.
Okay, thank you for that answer. Moving on, let's take a look at the next case.
When I first started performing the surgery, the majority of the patients who came to see me were soldiers. I'm not sure how they found out about it in the military.
I see.
Because it hurts. Yes, that's right. And they come here because they need treatment, rehabilitation, or sometimes because of mistakes made elsewhere. This is a soldier who was a former soccer player. We operated on both sides, and the ligaments inside both knees look good. This one is a soldier who was a taekwondo athlete in elementary school. He had surgery like this, and for this person who was originally a baseball player, you can see how we successfully removed the detached bone fragments through surgery. We also removed bone fragments for this soldier who used to be a soccer player. Looking at our country, there seem to be a lot of athletes, don't there?
That's true. Athletes, but
actually, since I've gathered all the cases I've operated on over the last 3 years, it just seems like there are a lot of athletes. These are cases regarding whether surgery is performed even for older patients, as mentioned earlier. This is a 30-year-old male. This has nothing to do with the military now. Since I've been doing these surgeries for 2, 3, or even 10 years, word has spread. People say, I'm older now, but my Osgood-Schlatter still hurts. But at the hospital, there's nothing much to do besides shockwave therapy or injections, and even those aren't very effective. So they come to me after finding out that this kind of surgery exists. So as you can see, despite his age, he underwent the surgery. And from here on, the patient histories shift towards leisure activities and sports. For instance, this person wanted to keep playing morning soccer despite the pain, so he had the surgery. During the surgery, you can see the bone fragments outside the ligament. This shows them being cleanly removed. It's the same here. There are many people who love soccer. He said it hurts when playing morning soccer. There were no bone fragments here, but I performed the removal like this. I neatly shaved down the bone where the patellar ligament attaches, so it no longer causes irritation inside. We've even reached the young 40 demographic who can't do other exercises because of their knees. So we've even had someone who enjoys Pilates come in. There are also 36-year-old community sports athletes. Did you know that?
I see. That's a bit surprising.
You should look it up. They do exist. So they say they kick the ball a lot. The bone fragments here were successfully removed. Now we're going up to age 50. A 50-year-old male who teaches baseball for entrance exams with a calcified ligament like this. We removed it, and here's a 39-year-old male's bone fragment. 46 years old. This one was quite memorable for me. He was stressed because he would finish hiking an hour later than his friends. That was his motivation for getting this surgery. He's 40 and loves soccer.
Probably because he's in pain.
Right? Yes. So this person is a doctor. He's a doctor with a bone cyst, and the cyst inside this bone fragment is quite large. It was removed successfully. The reason I'm presenting this is that almost all domestic patients come to see me. But if you search Google, it still says Osgood-Schlatter is a condition that doesn't require surgery. So if Beyond goes global and becomes known, I hope international patients will visit. For spinal issues, we get many patients from the US, Arab countries, and Russia. But for Osgood-Schlatter, we haven't had any foreign patients yet. This patient is a Korean expat living in Singapore who found out about us and came for surgery. This is a case of Osgood-Schlatter that's shifted quite far down. Normally, it should be around here, but it's positioned very low. So at first, I wondered if surgery was possible, but with more experience and improved techniques, I was able to follow it all the way down and remove the bone fragment. This person did weightlifting, and the bone fragment located very low here was also removed. And if you look here, this bone fragment was also removed by going further down. So it can also develop outside the ligament like this. This one is outside the ligament. For those who've had many steroid injections, we can remove it. Similarly, we performed surgery by scraping the ligament on the lower outer side. Someone asked about recurrence earlier. This patient had a very large bone fragment when I operated 4 years ago. They thought it was completely removed, but upon taking new scans, the bone had grown back like this. There's a part that grew back near the ligament, so there are still several bone fragments. We removed this part, but since this fragment is inside the ligament, we left it to avoid damaging the ligament. So this is the first recurrence case I've ever seen. I'm almost finished now. I'll just finish the presentation quickly. People in specialized jobs like soldiers or pilots also have to do various things, and they've had surgery. Then there are mail carriers who use stairs a lot. So they suffer from knee pain for about 3 weeks. This person in civil engineering also has to hike a lot. He's been taking painkillers since elementary school and endured it until age 29. He came for surgery and has since improved. In construction, if a problem arises, the knee pain is so severe that one has to walk with a stiff leg. It was removed successfully. For a 19-year-old male in culinary arts, he has to stand for 6 hours.
So
he stands for a long time, but can't climb stairs or run.
oh dear.
So he underwent surgery. This is actually the result you see here after the successful removal. And as you can see, the ligament itself looks perfectly fine.
Yes.
He's a sports instructor, so he does all of these. Bodybuilding, boxing, wrestling, jiu-jitsu, volleyball. He has to do them all.
That's quite a lot.
This person had surgery, and while I've only shown men so far, women have too. A physical education major who couldn't sleep due to pain from CrossFit had surgery, as did a woman doing Pilates who had a bone fragment. Also, a former cross-country athlete had surgery to continue doing CrossFit. After a fall, this 42-year-old woman also had surgery and regained her knee strength. So to wrap things up, Osgood-Schlatter disease is, in a way, gradually becoming something that patients are seeking surgery for more often these days, as our modern lifestyles tend to place a much higher importance on leisure activities, recreation, and regular exercise. To summarize, for Osgood patients with severe knee pain that doesn't improve with medication, this arthroscopic surgery has great results because it doesn't cut the ligament. It solves the problem while minimizing tissue damage, allowing for a quick recovery and discharge on the same day. So I'll conclude by saying it's a superior surgical method with minimal scarring and aesthetic benefits.
Okay, let's read one last comment from user Joa. What is the sign that I need to rest right now?
For Osgood?
Yes.
I tell people that if you feel a sharp stabbing pain while exercising, you should either stop that exercise, lower the intensity, or change your workout method.
Yes, thank you for answering until the very end. Well, today we've had a detailed discussion about Osgood-Schlatter disease with Director Yoon Sang-soo from Seoul Bumin Hospital. As an authority on arthroscopic surgery, he brought us so many different cases. I hope this was helpful for our viewers as well. We'll be back next time with more informative medical information that will be useful to you. So please look forward to our next session. Thank you for watching today.